Have you ever had that sudden, terrifying feeling where you just can't get enough air? It's like your body is screaming for help. Well, in this explainer, we're going to pull back the curtain on what's actually happening inside you in those moments. And we're going to follow the exact steps a doctor takes to solve this really urgent medical puzzle.
You know that sudden, desperate feeling of air hunger? It's not just a feeling. It's actually a pretty complex alarm system. It's a signal from deep inside your body telling you that something is critically wrong.
And that's exactly what we're here to do. Turn that fear into understanding. We're going to look at the internal alarms that actually trigger that feeling of breathlessness, and then we'll follow the clues just like a doctor does to figure out what's causing it.
So to really get a handle on this, we need to look at what's happening inside your body. Let's break down this internal alarm system that's basically screaming, "I need more air!"
Okay, so you can think of your body as having this incredibly sophisticated security system. And that feeling of breathlessness gets triggered when one of three very specific sensors sounds the alarm. The first, and probably the most obvious alarm, is something called hypoxemia. All that means is you've got a low oxygen level in your blood. See, when your lungs are compromised, maybe from fluid caused by heart failure or an infection like pneumonia, they just can't get oxygen into the blood effectively. Your body senses that deficit and immediately tells your brain, hey, breathe more, now. Now, alarm number 2 is hypercapnia. This one isn't about getting oxygen in, it's all about getting carbon dioxide out. So if you have something blocking your airways, like a really bad asthma attack or a COPD flare-up, that CO2 gets trapped. And when those levels start to rise, your body's sensors just fire off, driving that urgent need to breathe. And the third alarm is acidemia. This just means your blood has become too acidic. Now, high CO2 can cause this directly, because when it dissolves in your blood, it forms an acid. But you can also get acidemia from a totally separate metabolic issue, like diabetic ketoacidosis. And your body's response? It's actually kind of brilliant. It makes you breathe really fast and deep to try and blow off all that extra CO2 and get your pH back in balance.
Okay, so you got these alarms blaring and you show up at the emergency room. How in the world does a doctor start to figure out which alarm's going off and why? Well, it all starts with a very systematic investigation. This is what they call the minimum data set. You can think of it as the foundational toolkit for anyone who comes in with acute shortness of breath. The doctor listens to your story, they check your vitals, oxygen level, heart rate, they do a physical exam, and they get a chest x-ray. These 4 steps give them their first most critical clues.
All right, with that initial data in hand, the real detective work begins. Let's take a look at how a doctor uses these first few clues to start piecing the puzzle together and crack the case. Okay, let's open up our first case file, pneumonia. This is a super common reason for sudden shortness of breath. So how do all the clues point a doctor in this direction? Just look at how perfectly these clues line up. The patient tells the doctor they've had a cough and a fever. When the doctor listens to their lungs, they hear crackling sounds in one specific spot, and then, bam, the x-ray shows a shadow in that exact same area. Every single piece of evidence is pointing straight at pneumonia. Now, let's check out a totally different set of clues in our second case file. This time, the problem is fluid in the lungs coming from a heart issue, what's known as cardiogenic pulmonary edema. You can see this is a completely different pattern. So here, the patient already has a history of heart problems. The exam shows crackles all over the lungs, not just in one place, plus other signs of fluid overload, like swollen legs. Then the chest x-ray shows these diffuse shadows everywhere, and often an enlarged heart. All the puzzle pieces fit together to point to a diagnosis of heart failure.
But what happens when that initial investigation comes up empty? The physical exam is clear and the chest x-ray looks totally normal. This is where the detective work gets really, really interesting and super important.
In a situation like this, the whole investigation really pivots on one vital sign, the oxygen level. If the oxygen is low, even though the exam and x-ray are normal, the number one suspect becomes a pulmonary embolism, a blood clot in the lung. But if the oxygen level is normal, then the doctor has to cast a much wider net. They're looking at everything from heart problems and anemia to other metabolic issues. And this right here is probably the single most important lesson in a tricky case. Just because someone's oxygen level, their O2 sat, is normal, that does not rule out a life-threatening problem like a pulmonary embolism. It's a really common and dangerous trap to fall into. So all of this brings us to the final and most critical part of what we're talking about. Why does all this detective work matter so much? Well, because behind that symptom of breathlessness can be some truly life-threatening emergencies. These are the diagnoses that doctors absolutely cannot afford to miss. We're talking about a blood clot in the lung, a heart attack, a collapsed lung that's under pressure, or even fluid squeezing the heart shut. These conditions can kill if they're not found and treated right away, and they're the reason every single case of acute shortness of breath is taken so seriously.
And this really gets us to the bottom line here. Unlike a lot of other symptoms, sudden severe shortness of breath, or dyspnea, is not a wait-and-see kind of thing. Because of all the dangerous possibilities we just talked about, it always requires an immediate emergency evaluation.
So why does understanding all this matter to you? It's not about trying to diagnose yourself, not at all. It's about recognizing the signal. Understanding that sudden shortness of breath is your body's most urgent alarm gives you the knowledge and frankly the permission to act decisively. And that action could literally save a life.